Okay, so this demo is day 2 of the treatment plan, and we're going to be starting halfway through the session. This is Gerhard Borgman. He's 56 years old, and he's coming to me in outpatient hand therapy, post-op for Dupuytr's contracture surgery. Before this, I'm trying to think of the other questions you had. He lives with his wife at home, and he is out of work at the moment for 6 weeks because of the surgery, but when he goes back to work, he's a quality engineer in an auto body shop. Are there any other blanks that I didn't answer?
What are his occupational interests?
Oh, he likes hunting and fishing and house maintenance, but you'll hear all about that. Okay, we all set? All right, Mr. Boardman, how do you feel about that retrograde massage?
I mean, it feels good, but it's like still a little hard to straighten my fingers.
Right. It'll get easier as time goes on, but the massage is helping with that swelling that you're having right now. So now that I know that you can do that pretty well, you've already gotten your home program for movement, but now that we've done it together, you can go right ahead and complete this part, but you already have this at home. All right, so we have one more movement exercise for you to do, and it's called scar massage. So what we're going to do now, you're going to stay in this exact same position. So all you're going to be doing is you're going to be making circular motions on your scar. So let me come over and show you that. Basically what you're going to be doing is, like I said, you're going to keep it elevated in the same position as you were for retrograde massage, but what you're going to do is you're going to take your thumb and you're going to apply some deep pressure onto your scar, and you're going to move in circular motions, and you're going to move right up. And let me do it so that you can kind of feel what the pressure is going to feel like. Okay, so you're going to try and keep it nice and deep. What you're doing here is you're basically breaking up that scar tissue so that it's not connecting to the stuff underneath, and then we're going to have a bigger problem than we already have. All right, does that make sense?
Yeah, it makes sense.
How do you think you're doing? Do you have any questions?
No, it actually feels pretty good.
It does? That's good. All right, I'm going to let you keep doing that. We're going to do that just for a few minutes. When you do this at home, we're actually going to have you do it 3 times daily for 10 minutes, but we're not going to sit here and do it for 10 minutes right now because we've got a lot of other stuff we got to do. So that is the second part right down here. So now you are able to complete your whole movement, your whole home program for movement at home. Do you have any questions about this? Anything from before or anything like that? Do you think you got it covered?
Yeah, everything's all on the same page, right? Like
Yep,
everything's
yep,
on
everything is right here for that.
I think my wife's got it somewhere.
Yep. Okay, so while you're doing that, we're going to go back and keep talking about our conversation we were having earlier when you were on the ice pack. Okay, so we introduced what was called the COPM, the assessment that helps me understand what's important to you and what activities you're having problems with right now, so then we can gauge our treatment to the goals that you want to do. All right, so we already completed it, and I got some ideas, but now we have to go back and we have to score it, and I'm going to have us do that together. So as a quick recap, the things that you found really important were being able to care for yourself, like dressing, and you said that you had buttons and shoe tying was really hard for you. You also said that household management was important. You said something about how you clean up after dinner.
Yeah, well, me and my wife always had this thing where, you know, she cooks, I clean, you know, after.
Gotcha.
And I can't do anything, really. I mean, it's prevented me from doing a lot.
Right. So you're kind of Mr. Fix-It around the house?
Yeah, we kind of live in an older house, so it seems like everything's breaking all the time. And the little lady really doesn't know how to do much, so.
Gotcha. Then the other thing was your active recreation. Can you tell me a little bit more about that, with your leisure activities?
Yeah, I go hunting and fishing with the boys a lot, but you know, with that, I mean, I can't really hold a gun at all because, I mean, well, look at my hand, you know. Fishing's also impossible because I can't hold anything. So it's just, you know, all those guys are out there enjoying the day and I'm stuck at home.
And then the last one was socialization. You said you were having an issue with an active socialization activities.
Well, it is. I think it's also kind of a problem with my wife. A lot of the boys stop over in the garage and, you know, I'm working on this old Chevelle I have and they stop in and they want to drink beers and, you know, next thing you know, the wife's getting on me about drinking beers with the boys while I'm doing my medications and, you know, that I'm not any good around the house. And so I'm just kind of finding it hard to kind of separate that, you know, drinking from my, because I mean, all my buddies like to drink,
Yeah.
you know, so.
Being able to find social activities that don't incorporate alcohol consumption.
Yeah, I mean, it's hard because I do enjoy it, but I'm
Gotcha.
getting a lot of grief from the old lady, so.
Alright, so let's go through these real quick, and all I'm gonna have to ask you to do is rate each item from 1 to 10 on how important those activities are for you. 10 being it's the most important activity for me to do during the day, to 1 not being so important, okay?
Yeah.
I'm guessing they are gonna be pretty important because they're the ones that we talked about the most. So, personal care, dressing,
I'd say it's about a 9.
and why is that?
Well, my wife gets up and goes to work, and I've been kind of sleeping in lately, so getting up and like dressing myself is pretty tough because I go to work and I wear button-down shirts, and like that's pretty much all I own, you know, is flannel and work stuff, so it's hard to button my buttons, I guess.
How about the meal cleanup and the household chores?
Well, like that, you know, it's hard to pick anything up, or, you know, I can't sweep, I can't dust, I'm just, you know, as far as like fixing things as well, like I can't even hold a tool, you know, so it's,
So from 1 to 10, how important do you think it is?
well, she complains a lot, and I get a lot of grief, like I said, so, and I'm having a lot of issues with it, so I'd probably rate that at 10. I like to keep my woman happy.
How about your active recreation, your fishing and hunting and outdoor activities?
I do enjoy it. I mean, you know, like that, I like drinking, hanging out with my buddies. I'd probably say I rate that maybe about an 8. It's important, but not that important.
Right. And the last one is your socialization.
I do like to hang out with my boys, so I'd probably rate that a 9.
Okay. Alright, so now we're gonna go through these again, but this time I'm gonna have you rate from 1 to 10 on how well you think you're performing these activities. 10 being, I think I'm doing great, 1 being, I'm not doing so hot, okay? So the dressing and self-care, from 1 to 10.
Yeah, probably about a 2.
And the home maintenance,
That's about a 2.
and your leisure pursuits.
Oh, that's about I'd say about a 3.
And your socialization.
It's about a 3.
Alright, we are almost done. Now I'm just gonna have you go and rate from 1 to 10 one more time, but this time it's gonna be your satisfaction with your performance. Does that make sense?
Yeah.
Alright, so from 1 to 10, how satisfied are you with how well you perform your dressing and self-care?
Well, it takes me a while in the morning, so I'd say probably about a 1.
And home maintenance.
That's about a 1.
And leisure pursuits?
I'd say about a 2.
Socialization.
I'd say that's about a 2.
Alright, I'm gonna go ahead and score this on my own time, and then we can talk about this later. The numbers aren't really gonna mean much to you, but basically all it's gonna do for me is when we go back and we use this again towards the end of therapy, we can use that number and compare to the one that you just gave me now. We can also compare your comments and your thoughts on how you think that you've been improving. All right? Do you have any other questions or anything else that you think I should know about that I can also put on this assessment?
Not
You're
really.
pretty good?
Yeah.
All right. That's good. How are you feeling about the scar massage?
It's good. I mean, how long do I have to do it though? Because my other hand's hurting.
Yeah, we are all done with that, actually. So if that does, if you are starting to cramp up or if it's starting to get painful, always stop, take a break. If you have to work up to the 10 minutes at a time, that's perfectly okay. Okay? So the next thing that we're gonna work on, because we started this last session, was dressing. So what we did last session was we went over, I watched you try and unbutton your shirt and do like tying your shoes, stuff like that, and it was pretty difficult. It took us a while to get through that. What I did do at the end of the session, if you remember, is we introduced some adaptive equipment and just kind of like showed you what it was and what it's for, but we didn't really get to use it yet. So that's what we're gonna be doing today, all right? So if you remember, what is this called?
Oh yeah, that's that weird button hook thing.
It is. What do we do with it?
Button my shirt, I guess.
Mm-hmm. All right. So are you able to take that vest off so you have a little bit more wiggle room?
Yeah.
I went ahead and grabbed myself a shirt so we could be twins for a little bit. And how you're gonna button this, actually, first I'm gonna have you unbutton your shirt. Are you able to do that with one hand?
Yeah, it's not too
Like,
bad.
that's pretty easy. All right, so while you're doing that, if you can, watch me. All that you're gonna be doing is that you're gonna loop this around the button. Actually, you're gonna have to go from this side. You're gonna push it through the loop. And you're gonna grab the button on this side, which it might take you a little while to get used to. And then you're just gonna have to pull it through. And because you do have use of this arm, at least you can hold down while you're trying to push it through. And you might be able to even, so you don't even really need to use like your fingers and pinching and all of that. But you should be able to. I can show you again one more time. So you're gonna bring it through, and then you're gonna, you bring it through, and you're gonna hook the button. And you're gonna pull it right through the loop, and then you can go ahead and help yourself as much as you can with this other hand, okay? Do you have any questions?
No, give it a go, I guess.
Alright, you can try that. And I'll watch you for the first couple. Do what you can with that right hand as much as possible. This is just supposed to help you so you don't have to waste as much time trying to.
Does this thing ever pop off any buttons?
That's a good question. I have not seen it happen myself, but I'm sure with some strong men, if they're not careful, I'm sure it'll pop right off.
I'll tell you what, this will definitely save my wife a lot of hassle.
Yeah.
And at least I can sleep in a little bit.
So you'll be getting that pretty good. Nice.
Yeah, as long as it doesn't take off a button, I'm good.
Alright, cool. So I'm gonna have you, we're gonna practice that for a little while, but while you're doing that, I want you to look down at my sneakers that I decided to wear to work today. What makes them look a little bit different than usual? What do you notice?
You got some funny laces.
I do got some funny laces. Why I did this was because you told me that you're having a problem with lacing up your boots, correct?
Yeah.
Well, I actually know a little bit about how to lace your shoes so that you only need to use one hand to be able to tie them. So you'd be able to do this with your non-dominant hand, and you won't have to ask your wife to tie your shoes for you. You won't have to spend a lot of time trying to put your shoes on anymore. Does that sound like a good idea?
Yeah, that's good. I'm getting sick of wearing those ugly slip-on Crocs.
I bet.
Pain.